With a newborn, the baby that is so strong because they can hold their head up at 2 weeks old, that's not normal. That's not how it's designed. If they're able to hold their head up without the bobble, I mean, we're not talking about the try to hold your head up, bobble, fall forward. We're
That's
in this
right.
position where we're just a little bit in the sniffing position, and they
Yep.
are pulled tight. That is not muscle tension. That is dural tension. That will directly affect their nervous system. So that, when you picture the dura and where it connects inside the skull. And so it's attached, glued to the inside of the skull, comes up through the sutures, but then it goes down and it attaches at C2 and C3, the second and third cervical, right here.
Yep.
And then it goes down, and the other primary attachment is at the base of the sacrum, close to the coccyx. So if you have a sacrum, just for example, and you pull on that, you're going to pull on that dura all the way up the system, which includes pulling him into this position. So now they can hold their head up because they have a dural restriction somewhere in the system. But that can also happen if you have a cranial distortion. So you have a frontal that's shifted off, that's
Yep.
pulling on the dura on the inside, and again adds tension. So it's like pulling on a string but from the inside. So you pull on one end of the string, the other end has to respond too. It doesn't move independent